And we are sharing this screen. So just so you have that here. All right, guys. So I'm not going to actually go over this. Let me just do a little bit of an overview, and then I'm going to hand over to Saman. So today's overview, these are some of the most common questions that we get, and we've organized it in this kind of webinar format. And then at the end, we will take your questions as well. And I have a whole list of questions here as well that I'm going to be asking. So the first thing is, what is ADHD? What are some of the presentations, some of the symptoms of ADHD in boys, girls, and then adults? Because it looks a little bit different in different ages and in different genders. How common is adult ADHD? What causes ADHD? And then how do you get assessed for this? So all of a sudden, I kind of feel like I might have it. What do I need to do? Who do I need to see? What am I going to go through in order for me to get diagnosed with adult ADHD? So I am now going to hand over to Saman. I'm going to scooch on out of the screen for those of you who do have ADHD. I don't want to be distracting you. And I'm going to hand over to Saman.
Hi, everyone. So like I said, my name is Saman Ahmed. I'm a consultant psychiatrist. I was trained in the UK. And I still work part-time online doing ADHD assessments in the UK through Psychiatry UK. I'll just tell you a little bit about what brought me into ADHD. So I was trained in adult and older adults psychiatry. You get told about ADHD, but through our training, there's no extensive training in one particular field. For example, assessment of ADHD in adults. You do when you're training for CAMS, children and adults, but there was not a huge focus in assessing them. So there was a gap in service that I thought. So for personal reasons, what brought me into adult ADHD was I picked up, because I had knowledge about children's ADHD, I picked up that my daughter had ADHD. So I took her to a psychiatrist for an assessment. It was when she had an assessment, we realized that actually my husband was struggling more. And then he got assessed, and that was in his 40s. And he had struggled all his life with a lot of difficulties with ADHD. So I think there's a huge focus on children in schools, parents bringing them forward, and suddenly this disappears. As you become an adult, there's no services, there's no support, there's no structured assessments. And those are people who are really struggling in multiple facets of their lives, whether it be their education, in their employment, in their relationship, in their finances, the whole spectrum. And those are the ones that you would get into drugs and alcohol, who'd be in debts, who would be sort of having speeding fines. They will jump from one job to another. They will jump from one relationship to another. So if you look at them, it's very hard to empathize with them, because they just seem like reckless individuals who don't care about others but themselves. But if you don't know enough about ADHD, you struggle to empathize with them. You struggle to understand them. And that's where my passion in ADHD came from. And when I did come into ADHD assessments, what I did see was suddenly everyone wanted to diagnose their ADHD. Anybody who came in saying, oh my God, I can't concentrate, I must have ADHD. And there's so much on the media. So they watch YouTubes, they watch TikToks, and they want to diagnose their ADHD because they genuinely think they have ADHD. So a thorough assessment with assessing all the domains by professionals is essential. We don't want to overdiagnose ADHD, but we also want to help people who are really, really struggling. So that's where my passion comes from. So what is ADHD? So ADHD stands for attention deficit and hyperactivity disorders. It has 3 domains which you could have deficits in, which is hyperactivity, inattention, and impulsivity. So you need to have at least the 2 out of the 3. ADHD comes into, there are 3 different types in terms of diagnosis. You could have the attention deficit type, or you could have the hyperactivity impulsive type, but you could also have the combined type. It is a major public health problem. It has high prevalence, and like I previously said, it has an impact on your life, on your children's life, and your problems need to have stemmed from a young age, under the age of 12, and then gotten worse. We don't class ADHD as a behavioral disorder. We don't call it a learning disability, though you could have certain learning disabilities along with ADHD. It doesn't almost fit in with mental health condition either, though you could have a lot of other mental health conditions with it, but it is a neurodevelopmental disorder. Symptoms start in childhood, but they persist into adulthood. And like I previously said, it impacts several domains of an individual's life, like employment, education, finance, leisure. And it impacts executive functions, able to focus, able to organize, able to multitask, having an awareness of time. If I get to work, it takes me 20 minutes and I need to be at work at 9 o'clock. So let me leave at 8:30. People with ADHD are always late. They're 10 minutes short and then they realize they needed to be somewhere. Their speed, they're always late. Their assignments are always late. They're half filled in. They get repeated extensions. So all of that is present generally in people with ADHD. Now, we talked about symptoms starting in childhood, persisting into adulthood. People with ADHD, because of how it impacts your self-esteem, your ability to function, it comes with a lot of comorbidities. This is why you need to see a psychiatrist and a psychologist, because it needs to have a holistic approach, both in the assessment phase and the treatment phase, because sleep disorders are very common, mood disorders are extremely common, you can have personality difficulties as well. They often have a lot of history of trauma. Autism is extremely common, 50% comorbidity of people with ADHD with autism. And other difficulties, maybe you see less of that in this country, but you see a lot of burnout in people in this country. But in the Western world, you see a lot of gambling, you see a lot of substance misuse, and other addictions, very common as well. Okay, so like I said, 2 types, the inattentive type, which we often call as ADD, attention deficit disorder, or you could be hyperactive and impulsive. But I often see people who've got the mixed type, which is not uncommon. So if you look at it, 2 to 3 people out of 10 will have problems with at least the concentration and focusing. But not all of them will have the impulsive type or the mixed presentation. And those are the people who are often missed. They're not the ones, even in childhood, they're not diagnosed. They're not disruptive in the class. They're not causing problems. They're not having to get up and leave the classrooms every 2 minutes. They're not putting their hands up every 2 seconds to answer every possible question. They're just sitting there in the corner, doodling away, drawings but they're not causing any disruption to the class. They're in their own world, out with the fairies, like they say. So they're not causing problems. So they don't often present to services. They are not the ones who come to service. Parents worry less about them, especially parents who have other children who might have ADHD, who are hyperactive type. They're so focused on concentrating on them. They're all children who have autism, because it runs in families. So you will have other children who come to surface more often than these inattentive types. Okay, so the restlessness, inner restlessness, they can't relax. They can't go to the cinemas, they can't watch a film, it's too much. They would take out phones in the cinemas, they would be restless, they want to talk, they would go out to the toilets. If there's something they don't enjoy and they can't focus on, they'll go to sleep. So family activities for them that they can't engage in, they will switch off, they'll sleep. Fidgeting, nail biting, very common. They need to be doing something with their hands in order to be able to focus or even sit in one position. Family meetings, Christmas meals, people would say this person was always out or couldn't sit down, or would talk to them while standing. Very impulsive. A lot of them have problems with impulsivity. They'd had no money, but they suddenly think, oh, I'm feeling a bit sad. Let me just book a holiday. They book holidays on credit cards. They go on spending because they have low self-esteem. So they want nice clothes, nice jewelry, and they think that would lift up their self-esteem. That's what would make them happy. And because they're impulsive, they will spend money on these clothes and jewelry. They're driving in their own world, not focusing, and suddenly realize, oh, the exit is here. They needed to turn. They suddenly switch lanes very quickly. So high risks of accidents. They're usually nightmare drivers. They are either they're not paying attention, or they are impulsively braking or switching lanes. So this is why in the UK, if you've been diagnosed with ADHD, you've got to let the DVLA know that you've got ADHD. Yeah.
I didn't know that. Interesting.
You've got to let them know. Yeah. Again, inattention, difficulty paying attention. They can hyperfixate on something they're really, really interested in. And then anything less than that, they can't do. Anything that doesn't grasp their attention, extremely difficult to do. They would procrastinate every hour to every day to every month, and they've got stacks of things to organize and they can't get through them. Very, very difficult for them to do anything other than something they are extremely focused on. I often see people who say, oh, I really enjoyed, I got into this hobby, and then I got all the equipment that I needed for this hobby. And when I got all the equipment, I did it for 2 months and I spent so many thousands, and suddenly I got bored of it. So they then move. So they're habitually changing hobbies.
Can I ask a question about this, Saman? Because does it show up like that in that way for everyone? Or, for example, I'm not a bad driver, but, I can be an aggressive, or maybe I can get angry. So or I'm not late because I've learned to manage that. But, I'm super early because I'm anxious and I have ADHD. So could it be that it's not showing up in that exact way for people, but they could still be struggling on some sort of spectrum?
Absolutely. And some of them were like that, and they've changed behaviors. Yeah. They've learned.
Compensated.
Absolutely. And remember, we did talk about high comorbidities. Often they're very anxious. And do they compensate with their anxious? They would forget things. So they've got lists and post-its everywhere.
Yes.
And they've got reminders, alarms for everything. They've got their fridges full of notes. But the problem is sometimes they forget to even look at those notes.
Yeah.
And then they said, well, I've got to put notes at different places on my mirror in my bathroom and here and there, because sometimes I forget to look at that particular note. So it has to be somewhere else as well.
Yeah. Okay.
So you see that this is why psychological input is important, because you need to learn those strategies.
Yeah.
If you have ADHD, and a lot of us have learned strategies. A lot of those who've had parents who had ADHD have learned to adapt and develop strategies because they saw the chaos at home. Okay, moving on. So this is what it looks like for people with ADHD. This is what other people see: getting distracted, impulsive, concentration issues. But this is what they are suffering with. Deep it down, they have mood shift. They can't sleep. They can't switch off because they have so many thoughts in the mind. So they make all the plans when trying to wind down. They have a sudden business idea and they've got to get up and search it up right now. It has to be done right now. They're disorganized. They would go to put a wash in and then suddenly realize on the way there, something else catches their attention. So they leave the wash there and they get distracted to do something else. So you would see half-done tasks all across their house, all across work. They get overwhelmed because they were working on one thing and the boss comes in and says, no, this is a priority. Can you move? They can't suddenly move and do something else. They can't prioritize what needs to be done. And then everything is done half done. And that becomes a big problem for them. I'm not talking about those people who already have too much on their plate. They would be juggling. They would be anxious. Not all of them have ADHDs. So I think we just need to be careful, because you get all these CEOs or high executives, so people in very important positions who really do have a lot on their plate, and they are juggling. And it's not that they lack the skills, it's because the job demand has gone up.
Yeah.
And it's really is too much for them. So we've got to be, this is where a proper assessment is important.
And I think having these things show up in childhood.
Absolutely.
Right? This is not when you now have 4 kids and a job and elderly parents that you're starting to feel like this.
Absolutely.
Is that when you were a 5-year-old, it looked like that.
Oh, absolutely. Absolutely. They were chaotic. Their rooms were always untidy. They were always forgetting something for school, and there was always parents running after them to give their PE kits. So they've left this book and it was so important, and they're constantly running to school because their son or daughter had left something at home. So yeah, a lot of them, we need to have evidence. School reports often say, could do better if could focus better. If they could just sit down and concentrate, they could do so much better. So those are important. And that's where it's important. I'll talk about how we do the assessments in a minute. Okay. But the flip side is they are the ones who start big companies, exceptionally successful. They take risks. They develop unique ideas, and they're great thinkers and generally very intelligent people. And they can, because they can't often focus on one thing, they would say, you know what? I've got a patient at the moment who tells me, I can watch through a film, but I can knit a scarf as I watch through a film. I can't watch a film without knitting a scarf. Yeah. So they sometimes their divided attention is better than sustained attention on one thing. So yes, there's a pros, there's cons. So what we need to do is we need to facilitate the best in them with the support that we can give them. All these people have ADHD, and they've done really well. Okay. Diagnosed, there is conflicting views of, most evidence shows it's the same prevalence in girls and boys. Some say more in boys. I think it's because it presents more in boys because they are more hyperactive and impulsive compared to girls. I see girls more in the inattentive category than the combined or the hyperactive ones. But I think it affects, the girls become more vulnerable. I mean, in the West, you see histories of, as children growing up, they have a structure around them. The parents are preparing their lunches, reminding them to do homeworks, reminding them to make sure you have your uniform ready or whatever ready a night before they drop them off to school. They struggle a little bit when they go to secondary schools, when they're making their own ways to school, or they're kind of slightly more responsible for themselves. When they go to university and they leave home, it is so difficult. They like the independence because suddenly nobody's nagging them to clean their room. They hate the fact that people are constantly reminding them what to do, but they don't realize that's what was keeping them working or kind of in control of things. So they don't want to be nagged or reminded or told what to do, but they can't function without that reminder. So they go to university and suddenly they've got to prepare their own meals. They've got to manage their own time. They've got to provide a structure for their academics. They have to make sure they sleep at time and wake up at time. And they struggle. They miss lectures. They're impulsive. So there's a lot of binge drinking. There's a lot of promiscuous sexual activity. There's disinhibition. There is one-night stands. They're risk averse. And they struggle. They really do struggle. And a lot of referrals we used to get is university students. And they would sort of, they've done that year one, year two, and then they suddenly realize, oh my God, so how am I going to pass my degree? And I also see these Salhia students who've jumped from one course to another because it's almost like interest, isn't it? This was for me. And suddenly somebody said, oh, you're struggling with your essays, but this, a lecturer would say, but this is a creative work, you'll enjoy this. And they suddenly jump from one course to the other. And they do that so many times. They really do struggle to complete their degrees and actually anything that they are capable of doing. Okay. These are some of the data that I've managed to pull through different sort of researches. So worldwide, it's an old study, but similar ratio that I can see now is 5.3% of children, according to WHO. And different studies would say 50 to 70% persists into adulthood. And the prevalence being 2.4 of the ones sort of diagnosed. But if you look at the 70% of 5.3, and those are only diagnosed, we're not seeing those adults. And I wonder whether they're not aware of what their difficulties are. People call them, stupid, lazy, disorganized. And it really, really affects their self-esteem because generally they're very intelligent people. And those are the ones that I'm hoping could get help because it can change your life around. Okay. Higher familial loading. Adults are usually presenting to either those adults who are between 18 to sort of early 20s, who've gone into university, independent living and are struggling, or started working and they're struggling, or they're coming to us in slightly later lives when their children have been diagnosed with ADHD and they realize, and they've started reading into it, or their children are being diagnosed with autism. And when you open the websites looking into autism, ADHD often comes up because it's so comorbid. And then they realize, oh my God, I've suffered for it, all these things throughout my life. And that's when they start seeking help. So those are the presentations that I see often of adults presenting.
You were telling me a little bit earlier, Saman, about some of the other causes of ADHD, because this is genetic. You know, you're saying that parents and children and siblings, so there's a huge genetic component to this. But you were mentioning some other stuff to me earlier.
So there are lots of things that people are looking into. There were earlier studies which said pregnancy, sort of smoking in pregnancy, drinking in pregnancy, or even lead exposure. The earlier studies were saying that, but newer studies are focusing more on inflammatory processes of your brain. So what they've seen is some of the inflammatory disorders being very common in people who've been diagnosed with ADHD.
Like what?
So even things like people who've got allergies. Allergies is a big thing. There's lots of studies recently looking in people who have hay fever, asthma, or other allergies, or constantly sneezing. They tend to have more diagnoses, more common in people with ADHD.
You know, I recently had a nasal sort of issue, and I went to an ENT, and apparently I have a deviated septum that sort of collapsed into that. So I started doing some research on rhinitis, and they said there's a huge overlap between people who have this kind of collapse, and and not these open nasal airways. That also is linked to attention deficit. It just makes sense to me. I just like, oh my God.
It's probably because if you've got a deviated septum, your brain's not getting enough oxygen. So very interesting researchers are coming out. There's also a link between double jointedness or hypermobile joint that they're looking into, more common in people with ADHD. And there's a condition called Fragile X syndrome, where it's a genetic disorder where people are hypermobile as well. And they, in people who have Fragile X, they have very high proportion of them being diagnosed with ADHD as well. They're also looking at people who've had things like postural hypertension. They stand up and suddenly their blood pressure drops. So very interesting researches are coming our way, and it'd be good to see what we see in future. But what we're 100% aware of is the genetic link, because it runs in families. You will have people with even autism in the same family. So when we take history, it's not just the history of ADHD. If they have autism, that's a very important factor as well. And we do, this is where assessment is important, because your milestones, your being born early, birth trauma, hypoxia, brain injuries, that also in older studies have shown some impact. So it's important to have that history as well. Okay. We've already talked about this.
Never mind.
Okay. Again, links with maternal illnesses. Yeah, more research is needed, and there are lots of research that's been going on at the moment. How do we assess ADHD? So first thing is having a suspicion of ADHD. So if a child has had ADHD, don't think that their needs, as they turn 18, there's no needs beyond that. They need to continue being monitored. Saying that, a lot of them will grow out of it, or learn strategies to manage it. So they might not need medication past a certain age, but they need to see somebody to gradually take them off and see how they're functioning, all of that. So somebody who has suspicion, we will get them to do some self-assessment forms. initially. It's a long process where we also need collateral information from an informant. I tend to do 2, if possible. Collateral history from a partner that you've been living with for many years, because they know how day-to-day you function, but also from parents and school reports as to what did they say. Because remember, we need an evidence from childhood.
Yeah.
So obviously that is important as well. So it's a long process. If you come and see me and say, I have an 1-hour appointment and expect to be diagnosed with ADHD, I would not be doing you a justice too. So it needs to be a thorough assessment.
So how long does that usually take?
I would say that at least an hour to do a full psychiatric assessment, because what we need to rule out is, 1, is it really ADHD? Number 2, can it be explained by any other mental disorder? Because anxiety disorders could present the same way. You could be panicking and you can't focus, or you're on the phone so many hours or TikTok, because you're used to small bursts of hyperstimulation, that anything other than that you can't focus on. So a full psychiatric history, then a structured interview, maybe another hour for a structured interview for ADHD. I would also question about all the psychosocial drug history. What physical health problems do you suffer from? I would want to see if there's a cardiac history. Can we give you certain medications? Are they safe to prescribe on you? What sort of family history do you have? Some people I would do an ECG as well, blood tests as well. Then I would.
And you would do the ECG and blood tests for?
So various reasons. 1, to rule out comorbidities. ECGs to rule out any congenital heart defects, or just to monitor as we go along with treatment, because you could have certain changes. I also would want to see your weight and height. Hopefully as an adult, your height wouldn't change, but your weight could, because some of the side effects of the medication is that you might start losing weight. So that is important. If you have had a previous eating disorder, I'd be quite concerned in prescribing you certain medication. It raises, some of the medications would raise blood pressure. So I would need a week or 2 weeks of blood pressure readings before I would want to start you on a medication. So all of that, again, 1, we need to make sure it is ADHD. Secondly, we want to make sure it is not explained by any other mental disorder. Thirdly, we want to make sure it's not ADHD plus something else, because we need to treat that something else as well. That might be more problematic. Then we come to the treatment. What is the treatment? Do you really need medication? Or with psychological support, putting strategies in place, we can manage you. Also, a lot of people with ADHD have other learning disabilities as well, like dyslexia or dyscalculia, and it'd be good to be assessed for that as well. So I think
so all in all, if I were to come into your office today, it would take you maybe 3 hours, 3 sessions?
Probably,
to be able,
at least, yeah.
At least.
Yeah.
To be able to say, yes, this is. And then you would need some collateral information.
Yeah.
So you might need to talk to my husband, and you might need to talk to my mom or some caregiver that was around me.
Absolutely.
Would you need to have them in the office, or could they fill out a form?
They could fill out a form as well. But obviously, we've got population where we've got multicultural society. Not every parent would speak English or write English.
Yeah.
So, I mean, we've got forums of video calls. Or I'd be more than happy if a parent wants to join in and interpret to to be present in the session to give me that information, that's also fine. But that we have forms as well.
Yeah. But what if I just went and talked to my mom and said, listen, I need you to tell me what I was like as a child, what my teacher said about me. Did I get into a lot of accidents? Did I have a lot of injuries? Like, what if I just did the questioning and brought it to you?
See, the thing is, there's a lot of secondary gain these days in having ADHD diagnosis. People use or abuse stimulant medication.
Okay.
And I, as a clinician, it's a huge responsibility. I can't be dishing out somebody because they're doing all right, but they want to do better.
Yeah.
And they want stimulant medication. So yes, if your husband comes with you or partner comes with you and describes all those difficulties, but your parent can't come, but you've got that information, that's fine. But if you've got nobody to give me collateral and every information's been brought by you, I'd be a bit concerned.
Okay. That makes sense.
Because at the end of the day, we have a social responsibility. We, as clinicians, of who we diagnosed with ADHD.
Okay. So now we're going to take some questions. And I also have, so let's see. There's an article that someone shared. We'll look at that later. Someone says that ADHD does not exist. That's the title of the article. Is it possible to do an assessment online? Would you happen to have a website if possible?
See, the thing is, I do a lot of assessments online. Like I say, I do part-time work assessing people with ADHD, and it's all online. But it needs to be properly structured. Videos with your partner or your parents, and it can be done online, yes.
Okay. And so someone said that I'm constantly told by others around me that I have ADHD. Would it be possible to get an assessment, but I don't want medication?
See, you'd be surprised how many people just want to know that whether they have ADHD, just to be able to understand where the difficulties are coming from and to be able to adapt to it. There's a self-help book that I would recommend for people with adult ADHD. I'll tell you the name in a bit, but sometimes just psychological support is what they need in order to adapt to their difficulties and to help with their self-esteem, because often I see a lot of these people who've been prescribed years of antidepressants for depression and anxiety, and they've not done anything for them.
Okay, what is your personal opinion about medication and ADHD? Like, if somebody even asked it, like, would you medicate your child?
I would, and my child has been medicated.
Okay.
Yeah, I would. It depends on how the impact of the illness on them. So if the impact was that in their peak years of doing A-levels and university, it meant that they could not perform, or they were so chaotic or so attention deficit, they were sleeping in class, and their life trajectory was would completely changed if they were medicated or not, because they were not able to do an assignment and submit it in. And if it meant they would finish school after GCSEs, or they're able to actually get a degree, get a job, if it meant that for my child, I would medicate my child. Yeah.
Do antidepressants help with ADHD?
So antidepressants help with depression if you have ADHD with comorbid depression.
So they don't help with the ADHD side of things.
So some antidepressants, for example, atomoxetine is a treatment for ADHD, licensed treatment for those who can't have stimulant medication. It's actually pharmacologically an antidepressant. It doesn't work on the dopamine pathway. It works on the adrenergic and the serotonergic pathway, which is how most antidepressants work. And in 60% of the people, atomoxetine works.
Okay. So my partner is self-diagnosed with ADHD. He's doing okay in life, but it drives me crazy how he forgets everything and never focuses at home. And he has no interest in medication. What should I do?
So being a partner of somebody who's got ADHD, I don't know whether your partner has or not, because you're saying he's self-diagnosed. It's a nightmare. You're doing everything. You're doing all the house chores. You remember all the dates for social events, for your children's appointments. You're picking up after them. They went to one room. You're going to turn off the lights. Everything. It is a nightmare. And it's on almost, it is so difficult to actually have empathy for them. My continued ADHD works helps me maintain that empathy. But there's nothing you can do if they don't want to be formally assessed, or there's little you can do. There's a book that you can buy. There's a book on Amazon. I've got no links to this book and I don't get any money out of it, but I'm just recommending it. It's called You Mean I'm Not Lazy, Stupid, or Crazy.
You mean I'm not lazy, stupid, or crazy?
It's a self-help book for people with adult ADHD.
Could you talk a bit about substance abuse and alcohol dependence in children or in adults with ADHD?
So, a couple of things. One, they're impulsive. So they would, and they're risk takers. So they would try everything that they can. They've got less fears. They're thrill seekers, because that's how the front part of the brain, which is deprived of dopamine, gets the dopamine buzz or the hit. They get into it for novelty seeking, for thrill seeking, but often they get trapped into it. Stimulant use, I often have people saying, I tried many drugs, but it's amazing how when I used cocaine, my other friends were dancing off and really hyper, but that was the first time I could actually sit down and do my work. It's amazing. They would tell you the completely opposite story. They would say, when I took stimulants, i.e. cocaine mainly, that was the first, that calmed me down. It really relaxed me. And that, unfortunately, with a lack of awareness, that gets them into addictions. And addictions and ADHD, very comorbid.
And you're saying mostly because of the dopamine levels.
Yeah. A lot of them, there's a lot of things. One, they're impulsive, they're thrill seekers, so they would go into it. But they always, see, with ADHD, your front part of the brain, which is called the prefrontal cortex, lacks dopamine. And that's where your executive functions, your memories, and sort of a lot of the deficits that you see ADHD are due to. So these people would release dopamines by these drugs and they would feel better.
Okay. So someone asked, where do you get an assessment in Dubai? So Dr. Saman at TheLightHouse Arabia in Dubai is able to do ADHD assessment. We also have Dr. Hussein who can do the ADHD assessment. So we have two psychiatrists that feel very confident, and Dr. Saman obviously has a very long history with studying, understanding, and working with ADHD. So that would be somewhere where you could, and then online assessments are also available. But when we say online, it's not a form you fill out. You have to speak to a psychiatrist.
Absolutely.
And then the neuropsych assessment that you recommend, why would someone want to get that?
See, the thing is, remember we were talking about it earlier, how I can't remember things or I can't register things. There might be strategies that in your brain. So we need to see where the deficits in the brain are. So with neuropsych assessments, you check every bit of your brain. So certain areas of your brain, when they've scanned the brains, they've seen things, there's some areas are shrunken. So when we assess your brain in different parts of you get to know your strengths and weaknesses. And then you get to know how. So if I can't learn through this method, maybe this method would work for me.
Yeah. So this is, I mean, one of the reasons why, so I do have ADHD, and I've, when I was younger, they used to call me Jack in the Box, my teachers, and there was nothing at that time about ADHD on their radar. And so they would just sort of put me towards the back of the corner, back of the room, where I would just be bouncing around and learning. And I was learning everything, but I just wasn't able to sit still very much. And so all of my teachers throughout my childhood and throughout adult, even when I was in college or when I was in high school, I would be sort of sitting on the ledge of the class, on the heaters, or I would be in the back of the room, but sitting still. And you've seen me in our team meetings, like I can't sit still for very long. I have to be moving around because I just think better on my feet. I have a lot of energy, and I just feel like that energy it keeps me so distracted and fidgety that if I move around, that I can move some of that around. And for me, that assessment was very, very helpful because it taught me a lot about my memory, my working memory, my short-term memory. It also taught me about how I learn. Like, I'm an auditory learner. I'm not a visual learner. Like sensory stimuli, I have some level of sensory processing issues as well, because I get very stimulated very quickly. And so that was and then of course there's other things about learning about where my educational weaknesses and strengths were, like math not being one of them.
Yeah.
So that was very difficult.
But remember, Salhia, I said that I often see people with ADHD often have dyscalculia.
Yeah.
Maths is a common.
Yeah.
Especially in girls, it's a common. I could not do maths. I could do everything else. I couldn't do maths. But then you have the other categories who come either in the gifted category, who might have ADHD, but very gifted. But then you also have the autism ones, which also overlaps, who are fixated on maths, who excel in maths. So there is something about mathematics and ADHD, I tell you.
Can you speak a little bit about giftedness and ADHD?
See, a lot of people get diagnosed with giftedness, and they are exceptionally bright, inquisitive people who want to explore the world, who want to know more and more. So, but they're able to, so they're very restless. They all come across as restless, but they're actually very inquisitive. It's not that they can't sit down. They want to go and explore. So the intensity that you see them, or their impatience, or their high energy, people might think, oh, they have ADHD, but no, they don't, because they can focus on these things that they are interested in. They just don't hyperfixate on the one thing that they are interested in, nothing else. They're not distracted. So, and they're not fidgety. So there are the certain criteria that you see, people who are gifted, you don't see in ADHD. But saying that, there is an overlap as well in a small population. And so is with autism as well. There is a big overlap.
And when you say autism, I mean, can you say more about that? Because, I mean, there's a lot of people that have ADHD, that have autism, but are we talking about autism, because we have an image of an idea of what autism means, which is quite impaired.
Yeah.
What are you?
So autism is part of what we call as ASD, which is an autistic spectrum disorder. So it's a spectrum. You will have children who very impaired, delayed milestones, issues with certain textures, issues with touch, very sensory sort of difficulties that they have. They just have a very narrow repertoire of interests that they fixate on that. Well, whereas ADHD, they fixate on one, then they jump onto another one, and then there's another one.
Yeah,
so
that sounds like me.
so and their social norms are different. They lack empathy, all of that.
Mm.
But autism, there's a lot of people we see who are high functioning autism. I don't do those assessments, but we have specialists who actually are looking into now being on the spectrum, but not being very socially impaired.
Yeah. So you can have you can have autism without you knowing it, because you could be fully functioning.
Yeah.
You could have friends, you could be in a workspace, but there are these certain quirks about you.
But there should be some deficits. There are deficits that you don't think is a problem.
Yeah.
Because you might have one or two friends, but often you would also see, so autism also comes under neurodiverse disorder, like ADHD, but you would often know that these people get along with other neurodiverse, all their friends are neurodiverse.
Yeah. Yeah. So someone asked a question about caffeine. Can it have the opposite effect? And I would like to answer that question, because I remember when I was, and I made it through high school, I made it through college. And I, at one point it was really like, okay, this is taking me double time. I have to work twice as hard as another person. So I'm just going to explore medication. And then I went and I explored ADHD medication, but it was almost too strong for me. Even the lowest dose was too stimulating for me. Not stimulating because I wasn't hyper, I was super focused. But I felt
palpitation,
like
the anxiety on the edge.
I wasn't.
Oh, okay.
It actually didn't make any of that, but I was steady and focused like a sharp beam. But what I felt like it made me do, it felt like it made my brain sort of hard. I couldn't parallel process at the same time. I couldn't sort of take from here and take from here, which is how my thinking works. It actually is really random in my mind. And I felt like I lost my randomness, which in other words is my creativity. And my paper was the driest paper I have ever written. Even my teacher, my professor at that time was like, did you write this paper? Because he felt like I took it from someone else, because it seemed so unlike me, because I can weave together spirituality and biology and sociology. And this is how my papers usually were. I came at it from a very different type of space. And that one paper was the one paper that was super focused on the topic and only the topic, but it was the worst paper I had ever written. So then I went to my psychopharm teacher and I said, listen, I know I have it. I know it's been diagnosed, but like, what can I take that is not medication? And he told me, take coffee.
Yeah.
And from that day forward, I have a coffee every morning, and this is where I focus. I don't have agitation. I don't have heart palpitations. I don't have anything. Actually, my heart rate is always high anyways. So this was one thing that really, when you have this kind of moderate level, or even if I'm super hyperactive, because you guys can probably tell that I am, she's like feeling my energy right now. Even if I have that, I feel like it still allows my brain to move fluidly in that creative space without me becoming hyper-focused, which is the one thing that I just didn't like about the medication, was that I wanted to focus, but I didn't want to lose my creativity. And I felt like it made me lose that. It made me lose my personality, actually. And it was a very low dose. So it didn't work. So we have room for one more. We have time for one more question, and then Dr. Saman has got to go see her patients. Let's see. Could you talk about medication and therapy versus only medication? What type of therapy should I be looking for? I can talk a little bit about that, but I'll let you.
No. That's your area of expertise.
So I think this would really be a lot more. I mean, first of all, I think it's important that you learn insight. You learn about who you are, where your strengths are, because we do have a lot of strengths, people with ADHD. And then there are some things that there's just gaps, and those gaps are going to cause a lot of distress in relationships, in your professional life, in just you and your day-to-day functioning, and just being a disciplined human being that wants to do things with their life. And so learning behavioral type of interventions, learning things like, okay, well, I really am very forgetful. So talking to your therapist about like what are ways that I can remember, or what are some things that I can do in my relationships when I blurt out something that I shouldn't have blurted out, or I said something that wasn't actually really funny but I thought it was. These are some things that you're going to have to just build awareness about. And the more awareness you have, the more consciousness there is, the less likely you are to engage in such behaviors. And so ADHD can have a lot of, effects on your relationship. But I think if you were to ask my husband about me, I don't think he would say, well, no, I don't think I'm a nightmare to be married to. I think he finds me actually quite entertaining.
But you're living in a country when you have help.
No, it's not. Even when I didn't, because I just moved 14 years ago. But I think I really felt like I had learned those skills. Okay. I had compensated, and I have an anxious personality, and I don't want to disappoint people. Yeah. And so having that mixed with the ADHD, I mean, I really was. Every hour of my day has something written in it. Who am I going to call? What time am I going to call? What's the number of that person? So I became super, super rigid almost about my schedule. And these are some of the interventions that I learned just through my personal, I mean, I worked with psychologists on the college campus. I've worked with psychologists my whole life, really, since adulthood, since I entered college. And these were tips and things that I learned from that. But I also think just knowing that, I was very sensitive and I was very intense and I did move very fast. And I think knowing what therapy did for me was it made me realize my effect on other people, that when I walk into a room, it can feel like a tsunami sometimes. So just tone it down, Sal, or, maybe just, know your effect on other people. Or when you're angry, it's like the force goes out. And so I know I have a big effect on the energy in the room. So I really had to learn self-regulation techniques, because I didn't want to have that effect on my kids and overwhelm them, even though sometimes I feel like it still happens to them, where when I'm upset, they become completely dysregulated. So self-regulation, emotional regulation, time management, self-awareness, these were all skills that I felt like I learned through behavioral and psychological interventions.
I had a patient not long ago who had trackers on his keys, on his everything that he carries had a little tracker on it. That was on his wallet, because he said, I could track my phone, because you could track your iPhone, can't you? But the wallet you can't, the keys you can't.
You can now put like a tab on it.
So he had trackers on everything because he kept losing them.
Yeah. Okay, guys. I mean, we had literally so much engagement from you guys today. We have so many questions. So now, just so you guys are fully aware, Dr. Saman is taking appointments for ADHD assessments. We also have Dr. Hussein. If Dr. Saman is fully booked, we would be able to accommodate you in other ways. Insurance typically does cover psychiatric assessments. And so if you have insurance, check with your insurance to see if psychiatry care is covered. Oftentimes psychology is not covered, but psychiatrists, like medical doctors, are covered even in basic insurances. So that's something that you want to just call your insurance company and check with. Then
Salhia, sorry to interrupt, but I also know that sometimes insurance are happy to pay for psychology if the psychiatrist recommends it.
Yes. So even psychology care is covered, but for sure, medical care with a doctor, Dr. Saman, would be even in basic insurance, but double check anyways.
Absolutely.
And then just come in for an assessment. And like we said before, you do not have to go on medication. I am not on medication. I am on meditation now. I meditate a lot, which I really feel has helped me. But just having that diagnosis then just takes that, like, I don't know, it just gives you a sense of relief that, okay, I'm not, what's that book called? Stupid, lazy, or whatever, hyperactive. I don't know.
It's also in your partners. It helps other people understand you as well.
Yeah,
it improves relationships. And I think when we talked about psychology, if you've struggled in relationships, even family work could help as well in building up a lot of sort of miscommunication or lack of empathy or any of that, it really can help.
So you're saying
and
that
your children as well, if you know you have it, you know what to look for when your children are struggling.
Yeah. And so you're saying that even, so somebody had asked that question that, you know, how do you support someone who has ADHD? So learning more about ADHD, but even visiting their psychiatrist or psychologist with them to say, how can I support this person? Being curious about them, making sure that you're calm when they are making mistakes, because they actually can't help it. Just like if someone had, some other physical illness and they couldn't, like maybe I broke my arm and I couldn't lift a table, you wouldn't be upset with me. It's almost the same thing. There's some, blind spots that people have.
But if you have a sort of think about it, you've got a partner who's got ADHD who forgets things, and he asks you, can you remind me about this? Can you remind me about this? And you're constantly reminding, and you've got your own job to do, but you're constantly having to remember what the other person is supposed to remember, right? It takes a toll on you. But when you do that, you're constantly reminding them what to do. It's like, my wife's constantly telling me what to do.
Yeah.
So you can already see
how
the impact on the relationship.
It's better to just set your own reminders, guys, if you have it, because it does put a lot of pressure on the relationship. Now I have to remember my life and your life, and then I sound like a nagging wife. Like, that's not something that we want.
Absolutely.
And so I hope that this was helpful. And like I said, you guys can contact the Lighthouse if you want an assessment with Dr. Saman. Dr. Saman's other expertise is in elderly care, so psychiatry for the older adult and elderly patients, and we are going to be doing a conversation about dementia or just elderly care. What do we need to look for?
Confusion in elderly,
but not dementia only. How do I, as a child of an elderly parent, look for things in my elderly parents, but also what are some of the things that I need to be looking for? Because sometimes things do happen and we don't know what to look for. So we are going to be presenting on the 3 Ds, which are
we going to tell them now?
Yes.
Okay. Depression, dementia, delirium.
Which is what's going to be coming up in January. So this is for people who are taking care of their elderly parents, but also the elderly who would like to just know what to look for and in their partners or in themselves. So that's next time. So thank you guys for being here. This was the first time we've done something like this, and I feel very good about it. I feel excited about it. And if you guys have any other ADHD type questions, please send them on our Instagram, because Dr. Saman can then shoot a video out to you guys and answer that question.
Absolutely.
Thanks, guys. And thanks, Saman. This was amazing. Thank you.
Thank you. Bye-bye.